And welcome. It is April 4, 2024. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We have a patient who has traveled here from Colorado. And he's here because 11-12?
Yes.
Thanks. He's here because he has a herniated disc in his spine at T11-12. It's on both sides. It's pinching his spinal cord and nerves. He's literally going paralyzed. He's having trouble walking. I think he uses a walker, right?
Yes.
He uses a walker. He can't walk on his own because he's lost balance. He's lost control of his bladder. He's in bad shape. He's getting worse, but he didn't want to have a laminectomy infusion. He's already had open surgery, so he learned about our laser procedure and decided to come here. So we're going to do our best to get that fixed for him today. All right. Henry, he doesn't have pain. He has neurological compromise. So let's get started. Okay, let's get a shot. We're going to use our x-ray machine. We need to be a little more north. Shot. Shot. Good. So 12 is the one with the rib. Show us the rib. Very good. First rib is 12, then the rib above is 11. Let's go with a lateral view. You can see the needle coming in from the left side. My goal is to place 2 needles safely into the discs at T11-12. Drop the table a smidgen, please. All right. So you can see T12 appears to have a bone spur off the front of it. You want to show us that little bone spur there, Jordan? Yep. Now let's get the disc at T11-12 lined up because we have some issues with WAG. You can see the facets are not lined up properly. Now what I would tell you, if you do spine surgery, you're still off a little bit on WAG and a little bit on orbit. Maybe 1.5 degrees, 2 degrees on orbit. If you do spine surgery, you will use that's perfect. You will use the x-ray machine. How many degrees was it on orbit? 3 degrees. 3, so, all right. The x-ray machine in the operating room, we call it a fluoroscope. In the old days, I used to use an x-ray machine. We'd take a picture. We'd wait for the radiologist to call us and tell us where we were. It was unbelievable. Surgeries would take 8 hours just to do a microdiscectomy. But now with the fluoroscope, we're able to get real-time imaging and get immediate results. Of course, the surgeons have to be able to interpret the images, which I can, fortunately. All right, so show us T11 and T12. You can see the ribs coming off of T12. Yep, so that's going to be 12. That's going to be 11 there. That's 11. That's 12. And we're aiming for the disc between 11 and 12. Okay. All right, so let's see if we can't get there safely, which I expect we will. Shot. Shot. Lining up nicely. Shot. There's the posterior elements. We've got to make our way around the posterior elements. Shot. Posterior elements are the facets, as well as the spinous process and things like that. In this case, it's the facets. I'm going to come a little bit more lateral. Is he comfy? Num num. We're going to use a little bit of numbing medicine, which we inject locally. He's also getting some sedation. Lay still. Don't move. You're doing great. Everything's fine. All right. Perfect. So we need our patients awake for the beginning of these surgeries because I need a little bit of help to make sure I'm getting to the spine safely without getting too close to any of the nerves or other structures. You can see I'm still heading towards that T11-12. I started a little bit more lateral. Let's get an AP view. He's got a little arthritis in the facet joints just in front of the needle to the right of it. We're not here to fix the arthritis in the facet joints. We're here to get the pressure off the spinal cord. All right, so I'm a little too medial, which is what I like. I like to be a little too medial and then work my way laterally. Shot? Any questions? Shot?
Yes, we have a question from Royal ViewTube on YouTube.
Hello, Royal.
Asking Doc, are you familiar with the term disc, fix, and laser?
Disc, fix, and laser.
Yeah.
Well, I'm very familiar with laser. That's what we do. Disc fix, no, must be a new thing. All right. So you can see the needle is moving past the facet. That's perfect. That's what I want. And shot. We're gradually making our way down to the spine, right to the disc. Let's get another AP. I want to be sure things are lining up perfectly. Let's do one more lateral because I'm just about at the disc. See that? We're right at the back. I can actually feel the herniation with the tip of this needle right now. Oh, it's perfect. Just stay there for a second. And all right, shot. All right, let's go back to a lateral. Let's put some num-num. Any questions from the audience besides what Royal just asked me?
Other than that, no current questions.
And Royal, you know, just for so people understand, there are literally hundreds of spine procedures out there available to patients, but they don't work. They don't work. They don't fix the problem. And patients get suckered into them and end up having a procedure shot that doesn't work. And so we don't do surgery that doesn't work at Deuk Spine. Now, we may not be able to do a surgery because of a patient's anatomy or something, but we don't do surgery that doesn't fix the problem. Shot? And what I mean by fix is a permanent fix. It turns out that patients with back pain have more than one cause of back pain in over 90% of the cases. So if you know somebody suffering with back pain, there's a 90% chance that they have more than one cause to their pain. Shot? All right, so both needles are pretty much in great position. AP, right in the foramen, right where the herniations are. We're coming from both sides because his spinal cord is getting crushed on both sides by the herniation. It's a big herniation. And he's losing his feeling, he's losing his strength, he's losing his ability to walk. He can't walk independently anymore, can't even walk with a cane. He's using a walker. He's going downhill fast. All right, everybody agree we're at 11-12? Yes, sir. All right. Any other questions from our audience?
At this moment, no current questions.
All right. We're not going to, I don't think we need to do a discogram because he's not really a pain procedure. We are going to do a chromodiscogram, but I'm not going to do an evocative. So if you want, he can go to sleep, but if you want to, I'm ready to do it, so if you want to keep him awake for just a little bit longer, we might as well. But we're not doing a pain procedure. We're doing I'm going paralyzed from my spinal cord being crushed at T11-T12 procedure. So just a completely different, indication for surgery. Most of our surgeries are for pain. Are you comfortable? You could see his back surgery. He had surgery done not by me, by another surgeon in the past, but his problem now is a giant herniated disc. You comfy? Shot? How bad is that on a scale of 1 to 10? I saw you arch.
Give us a number.
Shot.
You're 0 to 10.
How high did it go? What was the highest it went?
9.
Wow. Have you ever had pain there? Yeah? All right. So concordant 9/10 at T11-12. And again, we're not doing this surgery for pain. We're doing it because he's going paralyzed. We're going to stop that, and hopefully, with some luck, he'll reverse and go back to being normal. I never promise that to my patients. I always tell them, 50-50 chance of neurological improvement. Gonna give you a little numbing medicine, lay still. But the real reason to do these types of surgery is to prevent the patient from getting worse. And there's still no guarantee about that either, right? We don't have guarantees. Deuk Spine offers a warranty where if you're having pain and you pay for the warranty and you do all the surgery I tell you to do, we'll cover any pain in that body part going forward if you need more treatment. We're doing lumbar or a big scope?
Yes, sir.
All right, any questions from our audience? So far, so good. You can see on the discogram, giant tear, big herniation, lots of dye in the epidural space because the dye is leaking out, and the dye is running just in front of the spinal cord.
At this moment, no current questions.
All right, let's show our audience how the Deuk laser disc repair is done.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from the video how we do this surgery. Basically, we're placing a dilator down to the herniated disc, and the dilator is what I have in my hand right now. Let's get an AP view. You can see I'm pushing and it's stopping. There's a gap there. That's all herniation. You can kind of make out the herniation. It's quite large, substantial, and it's pushing backward on the spinal cord. That's perfect. We're in absolute perfect position. I'm very happy about that. Now I'm going to advance, a little pressure here. I'm going to advance this dilator into the herniation. Shot. I'm literally pushing the herniation back into the disc, into the back of the disc where the tear is. And I'm going to extract the herniation from the tear, along with a debridement of the tear itself. And the reason for this is it's a lot safer to remove a herniated disc. Let's keep the maps up, okay? The mean arterial pressure. Let's get the guide wire out. Perfect. Keep them up. You know, cord is being crushed. I want to make sure our map is high. All right, so we've just pushed the hernia, not all of it, but most of it back into the annulus. We're going to remove the herniation from the annular tear. It turns out that in most patients, let's see where we are there. Yeah, that's really good. Yeah. Turns out in most patients that the herniation is scarred down to the annulus. So by using a laser, I can remove the scarred herniation. That's the advantage of the Deuk laser disc repair over other types of surgery like microdiscectomy, where the surgeon cannot use a laser because they can't see enough to be able to use the laser. With this scope, high definition endoscope, I can see 1/20th of a millimeter. So take a millimeter, divide it into 20 equal parts, I can see 1/20th, and I can remove 1/20th of a millimeter of herniation. A normal microdiscectomy, they can see down to 5 millimeters. With their naked eye, under the best conditions, which rarely exist by the way, the surgeon can see 5 millimeters. Under average conditions, they can see 1 centimeter, which is 10 millimeters. So I can see 200 times better than the average spine surgeon using the endoscope and working with the laser. I'm 200 times more accurate. So that precision pays dividends in results for the patient. When you're more precise with spine surgery, you're going to get better results. And by the way, that scares most spine surgeons. That's why the ones that don't know how to do endoscopic surgery and they don't know how to use a laser, all they do is criticize the laser because they're afraid of losing the business. Rather than saying, wow, the laser's amazing and I wish I could do that, let me learn, they say, oh, I'm lazy, I don't want to learn anything new, I just want to keep doing the things I was taught to do that we've been doing for the last 100 years that are dangerous, and I want to get paid well for doing it.
He was told the laser doesn't work and it's not bone at all.
Oh, yeah, he was told by a surgeon in Colorado that didn't want to lose the business that the laser doesn't work for his spine surgery.
No, for bone at all.
Yeah, I know. But I mean, that's what we do. We take some bone out. There's a piece of herniation. So unfortunately, he was lied to, like so many patients, about the laser by their doctor. And that's why we do our broadcast, folks. We want the truth to come out. We could not do this surgery without the laser. It's absolutely essential. And this is, if this works for him, it's going to be the safest and best possible procedure he could have done. Okay, that said, we're inside the tear. I'm removing pieces of herniation. And as I've said to you many times before, the herniation is never one piece. It's always multiple fragments, ranging anywhere from 2 or 3 pieces to 50, even 100 pieces of herniation in a disc. 100 is not common. If I had to tell you the average, I would say it's somewhere around 30. But when we talk about a herniated disc, we're not talking about one piece. We're talking about, on average, 30 pieces. All right. It's all part of the learning experience. I didn't know that going into endoscopic surgery that herniated discs had so many pieces of herniation that made up the herniation you see on the MRI. What you see on the MRI is a collection of herniations over time, typically 30 of them. Any questions from our audience?
Yes, we have a question from a few questions. This first one comes from J. Rod on YouTube,
Hello, J-Rod. Welcome back.
asking, good morning, doctor. Physiatrist here. Do you usually get patients that have not had success from invasive pain docs?
Oh, yeah. So the question, I believe, is do we ever get patients that have tried pain management that doesn't work? All the time, pain management doesn't work, period. The techniques that pain management doctors use, such as epidural steroid injection, spinal cord stimulator, implantable devices, interspinous devices, basovertebral nerve ablation, all of those treatments, facet block, rhizotomy, RFA, all of those treatments do not work long term. At best, they give temporary relief of pain. And that relief is usually, it could be anywhere from 5% to 100%, but it's always short-lived. As a matter of fact, we have a very busy pain management practice. And we've started to move away from recommending treatments that are only temporary, okay? And we're moving more towards treatments that give permanent pain relief. Permanent. So yes, we're happy to take patients that have failed conservative pain management treatment or traditional pain management treatment and fix them. And we can fix you. I feel very confident. So this is the herniation right here that I'm working on. And the good news is you can visualize one bone to the other. So we are dead center in this herniation and in the tear. And I can see all I need to see. So that's something I worry about with surgery. Am I going to see everything I need to see? For example, we literally just aborted a surgery. The first surgery today, I had to abort because the patient, I tried to do a C7-T1 foraminal herniation on the right side. The guy has neck pain and arm pain and weakness in his arm. And we tried to get in, and I told him ahead of time, there's a 20% chance I have to abort your surgery because I won't be able to do it safely. And so I didn't think I would have to abort it. Otherwise, I wouldn't have done it, you know. But we got the patient asleep and positioned really nicely. We did the best we could. We had the x-ray machine in there. You know, he had a very thick neck, but that wasn't the reason we couldn't do the surgery. The reason we couldn't do the surgery there's nothing to do with visualization or thickness of his neck. It had to do with the fact that there was a piece of bone on C7 that was just deflecting my needle away from the target. And it was pushing it towards something called the vertebral artery, which is something you don't want to damage. And I told him, you know, I'm not gonna take excessive risk with you during surgery just to get your surgery done. I would rather give a patient a refund and not take their money and abort the surgery if there's a higher chance that I'm gonna hurt them. So the good news is I've not hurt any patients with this surgery. The bad news is I couldn't do this patient. So we do have to abort procedures from time to time. It's not common. I put it about one in 50 patients. So it's not zero, but it is significant if you're the one getting aborted. Now, I mean, simple things like L5S1 discs, you know, you don't abort those because, I'm sorry, not L5S1, I meant L45. L45 is pretty straightforward. I mean, I would rarely ever have to abort something like that. But L5S1, very common, can be aborted because the iliac crest, because of hypertrophied facet, because of the collapsed disc space. I mean, you name it, there's a lot of reasons, but they're all related to anatomy, basically patient anatomy. We call it anatomical constraint. So unable to access the target in the body because of what's called anatomical constraint. Now, there's no way to know ahead of time if that's going to be the case. If there was, we would have done whatever we could do to figure that out. But the truth is that you're working with about a millimeter of accuracy in terms of whether or not you're going to get to where you need to go. So there's no test that gives you a millimeter worth of accuracy. Plus, the patients are asleep, right? And their muscles are relaxed, their body's relaxed. So because they're relaxed, we're able to get into parts of the spine we wouldn't be able to get into when they're awake. So no matter what, you got to put the patient asleep, relax them, muscle relaxers, and see what you can see. But basically for me, I always look at these things ahead of time when the patient's doing a consultation, and I think, what is the chance, you know, that I'm not going to be able to get the surgery done? And most of the time, it's not a problem. You know, we get it done. But some people, we just can't get there. So I always tell people when I'm worried, I tell them, there's a good chance I'm not going to be able to get this done. And they have to be willing to proceed with surgery despite that. I don't force anybody to do surgery. They always choose. But I like to make them have an informed decision. I want them informed properly. All right, next question.
Next question coming from Neil on YouTube. asking, if you just release the piriformis muscle without fully removing it, is there a risk that the muscle will scar down around the nerve and still impinge?
Yeah, there is a risk, Neil. So great question. So what Neil is asking is, when you do your piriformis release, is there a chance that the scar tissue will develop and scar back down to the nerve? Yes. But the same chance exists if you take the muscle out, right? Because there's still scar tissue when you take the muscle out. And there's going to be scar tissue right where you did your surgery. So there's a very high chance, even higher, if you cut the muscle out, of developing scar tissue around the nerve than there is doing it our way. The good thing about our release is that we're off to the side of the sciatic nerve. We're way far away. We are releasing the muscle in the best place possible to not get scar tissue that causes sciatic nerve problems after surgery. The technique that I've used for our Deuk piriformis release, because we pioneered it, it's a new way of doing it. The technique I use is the most intelligent way of fixing the piriformis problem. It's the safest, it's the fastest recovery, it's the most successful, it's the least chance of complication for many reasons. But the place that we go to release it is a very safe area. Whereas the sciatic nerve area in the middle of the muscle where most doctors do the release is not a safe area. It's dangerous and risky for the patient. All right, taking out pieces of herniation here at T11-12 through a left transforaminal approach. We're going to do the right side in just a minute, but we're still on the left side. There's a big piece of herniation right there. Oh, baby. Here it comes. Let's get the cameras on this one. All right. Not a record breaker by any means, but for a thoracic disc, that's pretty big. Look at that piece of herniation. Now, thank you, Luis. Look at this. It's really interesting. Can you see this, Henry?
Yes, we can.
So you got the blue part that has the dye, which is a fresher part. You got the scarred up part right there, which has been around for a while and your body attacking it. And then look here. You see the pinkish color right there? I don't know if you guys can appreciate that. That's inflammation. That means that piece has been being attacked by his body for a while, unsuccessfully removing it. That's why we're here. So you got inflammatory tissue, you have scar tissue, and you have pieces of fresh herniation. All right, that was actually a good one. A good blow for freedom and justice. Any other questions?
We have a lot of questions. This next one coming from Celeste on YouTube,
Hi, Celeste. Welcome.
saying, "Good morning, doctor. I have collapsed disc in my lumbar area. Can it be fixed? I am from South Africa. Your work is phenomenal. Thank you."
Thank you very much. Absolutely, we can fix you. But don't expect your disc to look normal when we're done, okay? What we are doing is revolutionary because we are curing pain in the back. But we're not making your spine look normal when we're doing it. You're not getting a normal looking disc, okay? You're gonna have an ugly looking disc afterwards. So you will be pain free. However, if you get an MRI, your disc will look about the same. Why? I want you to look here. See this tube that we're working in? From side to side is 5.5 millimeters. Let's just say 5 millimeters. 5 millimeters is as tiny of an area as an MRI, a standard MRI can see, about 5 millimeters on average, okay? Now, the laser fiber is 1 millimeter. That fiber is 1 millimeter. So the work that I'm doing is literally on a sub-MRI scale. An MRI is not sensitive enough. I mean, if you get like a 10 Tesla MRI, you could probably see. But the point is, we're fixing people physiologically. We're not fixing them anatomically to where they have normal anatomy, okay? So when you ask me, can I fix your degenerated disc? The answer is yes, I can fix it so it's no longer hurting you. But I can't make it look normal. Only the Chinese can do that. And the way they're doing it is they're taking dead people and removing their disc and putting it into living people, which I think is absolutely crazy. I would never recommend that ever. Can I do it? Sure. But why would you ever do that to a patient when you can get rid of their pain with this simple 20-minute procedure that you go home right afterwards. Whereas the Chinese, when they're transplanting discs from dead people into living people, it's basically a transplant. You have to be on bone marrow, you have to be on suppression, bone marrow suppression, chemotherapy for the rest of your life. And you know, you're going to get all kinds of diseases and complications, and it's highly invasive and highly dangerous. You could die from it. I do not recommend transplantation of a disc from a dead person into you, or even a living person. Not that anybody would volunteer. The Neuralink guy, right? All right, let's keep going with the question.
Next question coming from Lori on Facebook,
Yes.
asking, how long is recovery after having disc fixed with the laser as far as getting back to playing sports and lifting and working out?
Yeah, so our patients are able to start exercising activities the next day, actually the same day. I encourage them to go for a walk on the beach because we're right next to the beach. But as far as getting into sports, it just depends on the actual sport. So people, all of our patients are active. Nobody, here's the thing, if you have back pain and you get inactive as a result of it, you're either the type of person who wants to get rid of that inactivity and be back to normal doing normal stuff, which should be everybody, or you're the kind of person who, you know, just lives with the pain and lays on a couch and watches TV all day, soap operas, or, you know, they don't have a life. And we don't do these surgeries for those type of people that don't want to be active. We do it for the people that want to be active. So there's a piece of herniation right there. That thing is big. It just broke in half. All right. So how long till you can get active? Right away. Now, if you ask me, can I go back to lifting, you know, squatting 500 pounds the next day? No. This, by the way, is a huge piece of herniation. And I'm trying to get it. You see why grabbers suck so bad? They just can't really grab the herniation that well. So you got to break it up into little pieces. This thing is huge. I'm really trying to grab it, and it's just coming out in pieces. Here's another piece. Oh, wow, look at that. All right, bring in the cameras. Turn on the light. Henry, check this out.
Yes, sir.
That's a good one. So far we've taken out a lot of little pieces and 2 gigantic chunks. And there it is again. Same scenario, folks. You see the blue?
Yes, we do.
That's new herniation. You see all this white scarred stuff? That's old herniation. And then you got this yellowish, which is calcium from being old and scar tissue. And then you got some pink in there from inflammation. Pretty cool. Save that for me. I'm getting hungry.
Not a problem.
I'm just kidding. All right. Yeah. We'll give that to Dr. Davis for lunch. All right. Now, it's a little milky and hazy. Why? Because we just took out a gigantic piece of herniation. And now there's a little bit of venous ooze that's clouding the water, which is fine. You know, we expect that. All right. I think I've gotten all the herniation I can from this side. There's a little bit lateral, which I'm going to get right now, and then we're done with this side. We're going to move on to the next side. I know we got more questions. So remember, for those of you who joined us late, we're doing endoscopic spine surgery right here in the good old US of A. In Florida, we've been doing these surgeries for 18 years in June or July this year. So in a couple of months, it'll be 18 years. And this is the safest surgery in the world for your disc problem, like a herniated disc or bulging disc, degenerated disc, ruptured disc, spinal stenosis, any of those spine conditions other than tumors, fractures, and infections, which we don't treat. Any of those common conditions that you have, stenosis, radiculopathy, pain, we fix with this procedure. And this is the very best. It's the safest and it's the most effective treatment in the world. And we do all the spine treatments in the world. We can do them all right here at Deuk Spine. We don't do them because they don't work. If a treatment doesn't work, we're not doing it. So this is what we do every day. And once in a while, we'll do a fusion because some patients can't have this because of whatever reason, anatomy. And the next best will be a fusion. All right, let's keep taking questions, but we're pretty much done. That's the last of the herniation. I'll take one more look and we'll be done with this side. We're going to go to the other side.
Next question coming from JJ on YouTube,
Hello, JJ.
asking, is it possible to get a discogram by itself without surgery? I'm in year 6 of chronic neck and back pain. Doctors have not allowed me to get a new MRI. Every doctor I've asked about a discogram has looked at me like I'm crazy or laughed me out the office.
Well, I'll be honest, you are 100% correct. You're smarter than those doctors. You do need a new MRI if you haven't had one in a few years. And yes, we can do a discogram by itself as a diagnostic tool. I'm telling you, all the patients just like you, there's millions of you, you guys are being screwed by the medical system because these doctors are either too stupid to know the truth or they're not interested in the truth. And what that's doing is it's putting patients like you at risk because you want to be fixed and they just want to give you drugs or they want to give you procedures that don't work because they want to keep you coming back. They want to keep taking your money. All right, there is another piece of herniation. It looks like right there. So I'm going to go in and grab that guy as well. You patients have to stand up for yourselves, okay? You've got to stand up for what's right. And I will tell you what I believe is right, but you're not going to get it from your doctor. Hold it. These doctors these days are not trustworthy. They're all motivated by money. A lot of them have sold their practices to corporations that have one goal, and that is to take money, make more money off of you, the patient, your insurance policy. Okay? And they're going to subject you to all kinds of treatments that don't work, that are dangerous, and that lead to more treatments. And we're totally opposed to all that. At Deuk Spine, we want to figure out what's wrong and we want to fix it the right way the first time. So when I say to you guys, we can do all these treatments at Deuk Spine, we can. But you're not going to see us doing them because they don't work. We don't do treatments on patients that don't work. We can do them, but we don't do them. That makes sense. This is calcified. This is a really lateral to the cord. You can almost see the spinal cord right there at 12 o'clock. This is lateral in the foramen, and this is all calcified. Really hard part of the herniation, old part of the herniation. Today is Thursday, right?
Correct.
So I'm going to tell everybody, since we have a big audience today, right?
We do. We very much do.
I'm gonna complain a little bit, but I'm also going to empathize with you. Okay, I'm going to tell you some pieces of information that are a bit personal. And I only tell this to you guys not because I want your empathy, I don't. Because I want to highlight the truth about our medical system in the United States and the rest of the world. Okay? My mom was admitted to the hospital last week. Okay, she has an infection from her diverticulitis rupturing, and she has an abscess in the liver. Well, she went into the hospital here. I won't mention the name, but it's in Brevard County and it's in Cape Canaveral. Okay, you can figure it out. And it honestly doesn't even matter because this can happen at any hospital, and it does. She had basically was misdiagnosed. She had a procedure done, and where they tried to stick a needle in the liver mass, which was an abscess, an infection, and they eventually put a drain in, but when they put the drain in, they punctured her lung accidentally and got her lung infected. Now, she was laying in bed for a couple of days, and I was visiting her, and I told the nurses, you must turn her every 2 hours to avoid getting a breakdown of the skin. It's called a decubitus ulcer. You may know it as a bed sore. Did they do that? No. I told them, look, don't take my order. I'm a doctor, but I'm not her doctor, so talk to her hospitalist, the one that admitted her. Please ask the hospitalist to give her an order for turnkey 2 hours to avoid bed sores. Right? Did they do it? No. 3 days later, they decided she needed to be transferred to Orlando, to a more acute hospital, and she has a bed sore. Okay? How do you think I feel about that? I am enraged about it. I'm very angry. Why? Because bed sores are totally preventable. And she never should have had a bed sore, period. But she got a bed sore, okay? Because the nurses did not do the basic job of turning her. And it wasn't even that they don't know about bed sores or turning Q2 for a patient who can't move themselves because they're lethargic. It's that, plus it's just attitude, ego. It's just, I don't know how to explain it. It's not that they didn't know. It's that they choose not to do it, okay? Then she's got pulmonary physiotherapy ordered, and what does the pulmonary physiotherapist do? They don't show up, okay? And when you call the nurse, like, why is the physiotherapist not showing up? Their answer is, oh, they got too busy. But we know what they're really doing. They're sitting on their phone on Facebook or YouTube watching videos instead of taking care of patients. So unfortunately, our healthcare system is totally broken for many reasons. One of them is there's a lack of accountability of employees working on patients, caring for patients, to actually care for the patient, like to really care. There's no empathy, there's no sympathy. I guess the people that are being hired by the hospitals are just non-sympathetic, non-empathetic kind of people. They're hiring the wrong kind of people. When I was going into medicine, they asked us, why do you want to be a doctor? And if your answer wasn't right, it wasn't genuine, wasn't honest, they wouldn't accept you. If you said to them, I just want to make money and have an easy job, they wouldn't accept you. So unfortunately, medicine, in my opinion, is getting worse. And I worry about, patients, people that need care. I can't even get my own mom the best care. And that's despite even asking for it, even guiding the doctors, the nurses. They just don't listen. They don't care. They're off on some other place. They've lost touch with the reality that patients have to live with, to suffer with. If you're suffering with back pain, you shouldn't suffer. Get it fixed. These doctors believe that you should suffer and that you should live in pain. Many of them believe you're full of shit, that you're just lying, that you don't really have pain. They're crazy. So that's why Deuk Spine is so valuable. We're not valuable because we provide these amazing treatments only. We're valuable because we actually believe we can fix you. We know we can fix you. And we believe your pain is disruptive to your life. And we believe that every human being should be out of pain. So that's really what we're all about. That's the real value of Deuk Spine Institute, is our people here really care. And if they don't, I fire them. And but we're all set up really to basically take care of people and do what's best for the patient. All right. We're going on the right side at T11-T12. The dilator is now at the back of the disc, right where the herniation is. I'm literally pushing the herniation back in. Remember, he had a herniation on both sides, left and right. We've done the left side. Let's go see what herniations are on the right side. I will tell you, because we stirred up some bleeding on the left, bleeding is going to go right through the center of this disc and pass out to the right side where we are. So you're going to see a bit hazier kind of operation on this side, okay? Any other questions?
Yes, this next question coming from Bo on Facebook,
Hello, Bo.
asking, so that patient that you didn't do, can you help him in that bone removal so you can get to the disc, or does someone else have to fix that bone?
Great question, Bo. So I will be doing his surgery in 2 weeks. We're going to do a cervical laminectomy and foraminotomy. I can do it. There is no spine surgeon better at doing spine surgery than me, and even traditional types of surgery. I know it sounds arrogant, but it's not meant to be arrogant. It's just meant to be truthful. I will go in there and I will get his nerve decompressed, but I have to do it through a traditional type of open surgery. And he didn't want that. That wasn't his first choice. His first choice was endoscopic. And I told him ahead of time, you have a 80% chance I can get it. There's a 20% chance I can't get it. And that you're going to wake up and I'm going to tell you I couldn't do it. Now, I believed I could have gotten it, but once I started trying and I couldn't get in, I realized that I was going to hurt him if I did anything more aggressive. I was going to hurt him. These are all pieces of herniation, by the way, coming out. So we aborted, you know. We aborted it, but we gave it our very best, and there's nobody in the world that could do better in terms of endoscopic. I believe that. If I didn't believe it, I would have sent him somewhere else, you know. Yeah, it's not the outcome we want. We don't ever take a patient to surgery expecting to not be able to fix them. We always expect to fix them. But the reality is even when you get the very best, there's still a chance it won't work. So, great question. So yes, he will probably be back in a couple of weeks for a laminectomy, which will be kind of cool for you guys to be able to see. Just about done. 5 minutes max here. I've taken out a few good sized pieces of herniation. Nothing as big as the other side. Maybe they're still there. Let's get the laser in. But I'm not feeling, oh, there's a piece, but it's not really that big. I'm not feeling any giant pieces. It may still be just a lot of little pieces, but they add up. All right, any other questions?
Yes, we got a couple more questions. This next one coming from Cosmic Knight on YouTube.
Cosmic Night.
They asked, Dr. Deuk, how many stainless steel tubes do you have? Also, how are they disinfected?
We have probably like
Well,
I would say like a 30 of them.
we have, Luis says we have about 30. And I've got a few at home that I play with at night. I'm just kidding.
I would use
We have about
steam
30.
sterilization.
We use what's called steam sterilization. We use ultrasonic
Yeah.
to, you know, loosen up.
Decontamination with the washer.
We use decontamination with a washer disinfector, and then we do the, you know, sterilizer. Currently we're using a company called BellyMed out of Germany, right?
Yes.
Very, very high quality sterilizers. We've invested a lot of money. They're around $100,000 a piece. We have 2 of them, and you know, I don't believe in cutting corners or saving money when it comes to buying the best equipment. I believe in buying the best equipment. So everything we have at Duke Spine is literally better than the hospitals. The hospital equipment is not as good. As a matter of fact, there was one point when the hospital was borrowing our equipment to do spine surgery. So the problem is hospitals are on tighter budgets. Me, I love spending money on expensive things that are necessary. Some people like a Mercedes. I like a nice sterilizer. Some people go out and buy a diamond. I buy a scope. I love medical equipment. As a matter of fact, how many lasers we have? 10? We have 10 lasers now. And I'm not even building my building in Orlando anymore because it's too expensive. So I guess we're going to be having 10 lasers for a while. We can do the eeny, meeny, miny, mo's, and, you know. The reality is I thought we were going to build in Orlando, but the cost of construction in the United States and probably worldwide has dramatically increased, and it's unaffordable. I mean, the cost was 50% more than I expected to pay. It's too much. So we're just going to stay where we are for a few more years. And, you know, right now we're working on a lawsuit against Blue Cross Blue Shield. And if we win and we get Blue Cross to cover in network contract for all of our surgeries, laser surgeries, then we'll build the building in Orlando because we're gonna need it. Next question.
Next question coming from J Rod once more on YouTube,
All right, J-Rod.
asking how much does the laser and machines you work with cost?
$1 million. So I don't know what machines you're talking about. If you're talking about all of our equipment that we use, that everything we need, the endoscopes, everything to do these surgeries, it's about $5 million worth of equipment on any given day. The lasers, unfortunately, the company that was making them was bought by a very big for-profit company called Boston Scientific. And now Boston has jacked up the prices on the laser. They've more than doubled the price. That's why I bought 10 of them before they jacked the price up, so that I wouldn't pay the jacked up price. Plus, the new laser they have called Moses is designed to break down more, so you have to pay for more fixing. And it's designed to, the parts are more expensive, and you can't just hire like a normal technician to fix it. You got to hire their technician, because it's got chips on everything, so that they force you to use their technician, their expensive parts that cost a lot more, and to buy their expensive laser that costs a lot more. It's a scam, folks. I'm telling you, there's a lot of corruption in healthcare. And I'm fighting it, but I feel like I'm the only one fighting it sometimes. Yeah. It's not big business for us. It's big business for other companies. Just about done. I got probably 3 minutes left, Dr. B. Our next surgery is going to be a single level lumbar DLDR. Which level? 5-1, my favorite. Yeah, just document all that. You hear me?
Sure.
Keep it documented. All right, next question.
Next question coming from Sherry on Facebook,
Yes.
asking, can you tell me what spondylitis in the lumbar spine is, and does it cause leg symptoms, and how do you fix it?
Yeah, sure. Spondylitis is a problem with the disc. It's basically the same thing as degenerative disc disease. It starts with a herniated starts with an annular tear, then a herniation, and over time, for many years, the disc collapses and you get arthritis in the disc. Remember, arthritis is inflammation within a joint, right? Your knee, your hip, your shoulder. Well, the discs get arthritis too. So itis is inflammation. Spondyloarthritis is inflammation of the disc. Okay? Ooh, he's not liking that. Just about done. He's feeling a little bit, but not much. We're done, so I wouldn't put him too deep. I don't see much herniation left. Probably another minute.
Was the last patient here? Thank you.
All right, I'm pretty happy. Now, how much herniation did I get out here? Probably 50%. And is that a good number? Absolutely. We can't get 100. You're never going to get 100. No doctor on earth can get 100. It's impossible. You know, it's unrealistic. If a patient ever came to me and said, I want 100% of my disc herniation removed, I'd say, no problem, go somewhere else. I can't do that. Huh? You'd have to, it's not possible because of the angles. You would have to take out their entire spine. Let me have the grabber. Let me just make sure there's no more herniation I can get. Any other questions?
Yes, we have a couple more questions. This next one coming from Johnny on YouTube.
Hello, Johnny on YouTube. Let me see if I can get just a little more with the laser. Yes, Johnny.
Johnny asked, I had a laminectomy L4-5 last year and it did not help. I have a new MRI with report that indicates disc bulge and facet arthrosis and ligamentum flavum hypertrophy sent MRI. Can you help?
Yes. we can absolutely help you. That's what we do. We fix the symptoms from those problems so that they go away permanently for you. We're the only place in the world that can, because of our treatments. We have treatments nobody else has. We pioneered them. They're literally 30 to 50 years ahead of the rest of the world. I just got my first patent on one of the treatments. So, you know, it's not like other people are going to be doing it unless I share the patent with them. Okay? So yeah, you should do our free MRI review. And with that free MRI review, I'll tell you what's wrong and how to fix it. We do it all on Zoom from the comfort of your own home. All right, we're done. Let me just see here. We're outside the disc right now. This is the outside of the disc, and I don't see any more herniation here. So I'm pretty happy. Yeah. All right. If there's more questions, I can come and answer them face to face.
Yes, we do.
Let's take a look at the herniations, though. Luis has lined them up like a little parade, like the Macy's Rose Parade. Is that what it's called? Rose Parade? You guys see it right here? No, not Rose. That's in Pasadena. Macy's is in New York. I see. You guys see it right here?
Yes, we do.
And, of course, that's not all the herniations, because there's a lot more that we didn't even, you know, get that are laying around everywhere. But right there. All right. I will come and answer your questions face to face. Scope use is a 6. You guys can see the incision on the other side. It's 1/4 inch. You see that right there?
Yes, we do.
All right, let's go ahead and take them away to a testimonial, and I will come and answer questions.
Copy that.
I'm Dr. Deuk. I'm sitting with one of my patients who had life-changing surgery yesterday. She's crying because she has, I believe, tears of joy, and she wants to share her story with you. How long have you had thoracic spine pain for?
Over a year now.
How did it happen?
I got into a decent motor vehicle accident on September 12th of 2022
And that was in California where you live.
in California.
And you've been in pain since then.
Since then,
What did the doctors in California do for you?
I've seen 4 different neurosurgeons. All 4 had a different opinion of wanted to do surgery. I was too young for surgery, and majority vote was to seek out pain management for the rest of my life.
Pain management for the rest of your life. And how did that make you feel?
Like my life was over. I went from being gym rat, as you call it, and 4 different softball teams. I was an athlete, I was a coach, worked out 5 days a week, to not being able to do anything.
Yeah, I'm sorry. Where did that leave you in terms of options?
A lot of depression, a lot of mental. This is my new life. Deal with it. There was no help. And expect you to live on pain medicine the rest of your life.
So how did you find Deuk Spine?
I had pretty much personally given up. I felt I had tried every option in California. I had no idea going out of state was even an option. Thanks to my husband, he is the one that dug and said, I'm not quitting. There's got to be another option. There's got to be another person. There's got to be another opinion. He searched and found a old YouTube video of someone with the same T7 injury that I had. And he said, we're going here.
To Deuk Spine Institute.
Yes.
And you did. We did our MRI review with you, and we identified several discs in your thoracic spine that were probably causing pain. And when you got here on Monday, we did a special x-ray, didn't we?
Yes.
To help localize which of those discs were causing the most pain.
Yes.
And we figured out it was 2 of them that were really bad, causing most of your symptoms. And you had your surgery just yesterday, didn't you? You can
did.
see in the surgery, we made 2 little 7mm 1/4 inch incisions. We went in with the scope and the laser, and we cleaned out the herniations that were causing all of that pain that you've been suffering with. How do you feel today?
Like a whole different person. I got out of surgery yesterday and just cried.
Cried because the pain was gone.
It was gone.
Yeah. And that's A pretty big deal, isn't it?
Like you wouldn't believe.
Oh, I understand. That's why I chose to do what I do, to end people's suffering. Where other doctors fail, we can help people. So the pain you had that was unbearable is now gone.
It's gone.
And is your husband happy about that?
It was very emotional last night. And he said, "Are you crying because you're hurting?" I said, "No, I'm crying because I'm not in pain anymore."
It's impressive. So if you had to do it all over again at Duke Spine, would you?
1000%. I don't regret a day of it, any of it.
Well, I'm hoping someday this technology will spread and other doctors will be able to do this procedure to help people with thoracic disc pain. You had those herniations just ruining your life, and now you have a new life to look forward to. What are you looking forward to the most?
Being the parent I once was with my 3 kids. Going to the gym again, not waking up in excruciating pain, and just living a normal life that I once had.
Did you talk to your kids?
Not yet.
You haven't? Okay.
No.
Well, and by the way, we don't have you on any medication, so you're not on pain meds, are you?
No.
We didn't give you powerful narcotics to kill your pain. You had propofol sedation. For those of you who don't know what propofol is, it's not a painkiller. It just makes you sleep. So when you wake up, whatever pain you have, you have. There's no pain meds used at Duke Spine after surgery. We want our patients, we want them to experience what life is like without pain medication and no pain.
We accomplished that.
Anything else you want to tell your fans out there or family?
If you're in pain, this is the place to go.
When do you travel back home?
Today at 5 o'clock.
All right, so we got to get you out of here.
Yeah.
All right, congratulations.
Thank you.
I'm happy for you.
Thank you.
Good morning, I'm Dr. Ara Deuk-Majan, CEO and founder of the Duke Spine Institute. I'm here with one of my patients who's traveled as far from Austin, Texas. He came to Florida to Duke Spine Institute because he had a problem with his thoracic spine. He's had pain in his thoracic spine, and I'm going to let him tell you a little bit more about it. But I can tell you one thing, he just had surgery yesterday, the Duke laser disc repair. How are you feeling today?
I feel amazing. The relief is incredible. It's more than I imagined.
And you were saying outside you were on the verge of crying, or you were crying yesterday because of the pain relief. Tell us about that.
It was really weird. Liz asked me what I wanted to do. I just burst out. Couldn't stop myself. It's just so amazing to have the relief. It's incredible. I never thought it would come. I've been looking for this for so long. It's been a very, very long journey to find you.
39 years, right?
35, yeah.
35
years.
Tell us about that 35 years of suffering you've gone through.
It started with lumbar cramping, muscles seizing to guard the injury that I couldn't even find. I went to countless chiropractors, neurologists, neuromuscular therapists. They took MRIs of my lumbar and said my back was great and that they couldn't help me. They had no idea why my back hurt. Finally, 5 years ago, somebody took an MRI of my thoracic, found 4 herniated discs and said, well, there's nothing we can do. Maybe in 20 years we can fuse all your vertebrae and that's it. I just wasn't willing to accept that. So I just kept looking and I found a video of you talking with one of your patients about a thoracic disc injury that you fixed. And so I called and it was the best thing I ever did.
And then you drove here.
We flew in, but
flew here.
It was a long trip. I'm from Austin, Texas. And I looked everywhere. I was like, well, if he's doing it, somebody nearby is doing it. No, nobody is doing this but you.
That's right. We're the first in the world.
We have to fix that.
we Duke Spine pioneered the thoracic transforaminal endoscopic Duke laser disc repair, which is what you had done yesterday on your thoracic disc. And how do you feel today? Are you having any of that pain?
None of it. It's all gone. I had referred pain near my piriformis. I had referred pain in my heel. It's all gone in a day. I was having muscle cramping up my entire back between my shoulder blades. It was giving me headaches, and it's all gone.
How did the pain affect your life?
It was terrible. I couldn't sleep. I couldn't sit for very long. I couldn't stand for more than 5 minutes without shifting or moving. It made driving difficult. Everything, and it was going downhill. It was continually getting worse and worse. Flying on a plane was difficult just because I had to sit still for so long.
And your wife, she was worried about you all the time because you're suffering. I mean, and it's hard to do anything enjoyable together, hiking, walking.
Yeah, I really
canoeing.
couldn't do much of any of that. Everything was very short term because the pain would just get overwhelming.
And you're from Austin. Austin's a wonderful city.
Yeah, we have a lot of
There's so
outdoor
much
things to do.
Yeah. And so how did your pain affect your ability to enjoy nature in Austin and everything it had to offer?
We stopped going out. We literally just confined ourselves to the house, and it was all my fault. And I felt so bad for my wife, and I was tearing up our relationship because of it.
And this is what I'm talking about when I say relationship, is people with chronic pain, they don't just miss out themselves on life, but their loved ones miss out too. Because if he can't do anything enjoyable outside because his back hurts too much, well, then she can't really either, because she's going to be by his side. When you're by the side of your spouse, that means you're suffering every moment they are. So this is a new chapter in your life that you're going to open because you guys came to Deuk Spine.
Yep, I'm so excited. I'm so excited. This
I'm
is
excited
amazing.
for you. And you can see actually in the surgery, we went in with a tiny little cut on his back, a couple of them, and we went into the discs and we repaired them using the laser. You could see the tears and the herniations coming out. You watched the videos after, you saw the herniations coming out, and you were impressed about how big they were.
Yes.
Yeah.
They were huge.
So anything you want to say to your audience?
If you're suffering, stop. Call, get help. There is help. He can fix you. It's amazing. And the whole staff here has been incredible. I know I was a bit of a pain in the butt when I first got here because I couldn't pinpoint exactly where the pain was coming from because it was so widespread, and you were amazingly patient.
Well, let's talk for a moment about that because you bring up a great point. The process that we... Okay, we had to cut the testimonial short, but there's a lot of questions I want to get to. I'm Dr. Deuk. I just completed this bilateral T11-T12 endoscopic spine surgery with a laser on a patient who traveled from Colorado because he was told by his surgeon that he had no other choice but to have major surgery with fusion and metal. He didn't want it. He looked for alternatives. He was smart enough to realize that there was a tall tale being told, and he found Deuk Spine. I felt we could achieve great results with the laser, better than any other surgery, and so we talked on Zoom. He did the MRI review for free, and here he is getting his back fixed. Everything went really well. We lost about 5-6 cc's of blood, more than we normally do, but not much. It's like a nosebleed's worth of blood. So really no blood loss. He was asleep for the surgery. He's waking up now. As a matter of fact, he's already awake. He'll be out of here in an hour. There's no hospitalization with our endoscopic spine procedures. It's outpatient. There's no hospital stay. There's no need for follow-up. There's a self-guided physical therapy with some restrictions that we cover for first year after the surgery. But it's as easy as it could possibly be for patients. All right, let's go to our first question.
First question coming from, forgive me if I mispronounce this name wrong, Shpetim on YouTube, asking, "Hi doctor, I have disc herniation L4-5, which has caused me foraminal stenosis on both sides. Can you treat it? And if so, what should I avoid after the operation?"
Shpetin, yes, you have the perfect disc herniations for the Deuk laser disc repair, the procedure you just watched. Absolutely perfect. I do need to confirm that looking at your MRI, so submit to our free MRI review. That's mri.deukspine.com, free. Just fill out a few questions, and we don't send you advertisements or any of that. We don't charge you. We just do a 10-minute Zoom call. I verify what needs to be done with you, the patient. I look at you, I examine you, I make sure that we're doing the right thing to help you, and then I give my recommendation to a scheduler who will reach out to you. But yes, you want the endoscopic surgery. That is the best treatment in the world. It lasts, and yes, we'll go over restrictions. The main restrictions are, for the first year, I don't want you lifting over 40 pounds maximum. No contact sports the first year. No wrestling, jiu-jitsu, riding horses competitively, riding bicycle, the Tour de France competitively. I mean, there's so many potential sports out there, right? MotoGP. I just have to know what it is that you want to know, if you can do it or not, when you can do it. So I'll tell you. The other restrictions are no bending at the waist for 3 months to pick anything up from the ground. So pretty much take it easy, let your discs heal properly now that we've cleaned them out. Clean out the tear and the herniation, let it heal, and then you can do whatever you want after 1 year.
Next question coming from Lanu on YouTube.
Hello, Lanu.
Asking, is there a hotel nearby Duke Spine Institute where patients can stay overnight?
Yes, we have several hotel options, and my staff can give those options. There's lots of hotels. They're very affordably priced, just over $100 a night, right?
Roughly.
Yeah. I remember in the days when they used to be $60, $70 a night, but inflation has raised the price for everything. Of course, our prices have stayed the same, but everyone else seems to be, grabbing more money. That said, we have probably 10 hotels nearby that are all between $100 and $250 a night. We don't have any Ritz-Carltons, unfortunately, but we have nice hotels, very clean, new hotels, very nice accommodations. I don't know the names.
I know we have a Marriott.
We have a Marriott. We have a Marriott. I think we have an A-Loft.
Yes,
Yeah.
somewhere around there.
They're all close by, within 5 minutes, and you can get an Uber. There's also nice restaurants nearby.
Yes.
So it's a really good experience. You're close to the beach, so after the surgery you can go for a walk on the beach. Yeah.
Other than that, the next question coming from Lori on Facebook,
Yes, Lori.
asking, I had a nerve decompression laminectomy at L45 5S1 3 years ago. Now MRI indicating it's all slowly coming back that I've had repaired. Now have a herniated disc at L2. Is it common for it to reoccur?
Okay, so great question. Yes, it is very common, Lori, for herniations to reoccur when they are not done the way we do them. So what happens is, what you had is called a microdiscectomy. There's a partial laminectomy, there's a partial facetectomy, and then there's a discectomy. That's what I believe you've had done, based on what you're telling me. I don't know that for sure. But what happens is, when you get a herniated disc, there's a wall around the center of the disc, okay? That wall is called the annulus fibrosus. Annulus fibrosus. I'm sorry, I'm looking for a pointer, and I can't find one. Here. Okay? So the wall is very strong. It's made out of collagen and elastin, very tough, like a tendon or a ligament. And in the center you have this jelly material called the nucleus. Every herniation, every single bulge, herniation, slip disc, bulging disc, ruptured disc, protruded disc, extruded disc, you name it, always starts with a tear in the wall, and then the stuff from the center of the nucleus pushes into the tear. That's the herniation. When you do a traditional microdiscectomy, the surgeons don't know, they haven't been told, they've never been trained, they have no idea that there's inflammation, that the nucleus, the jelly, gets stuck to the tear, and the tear can never seal. The only way to get the tear to reseal, the only way, nothing else works, no disc seal, no barricade, they don't work. The only way to get the tear to reseal is to clean the tear, get rid of the herniation, and this is done with the laser. That's what we do. It's called the Deuk laser disc repair. I pioneered it. I'm the first one to do it, the first to publish it. Nobody else does it. So here's the problem. When I say nobody else does it, what I'm saying is, if you've had a microdiscectomy, you've had the type of surgery where you are going to be prone to reherniation. Why? Because nobody else does the laser debridement. Therefore, your disc will never heal. You'll always have a tear, and it's just waiting for another herniation. That's why we don't recommend microdiscectomy or laminectomy. We recommend the Deuk laser disc repair so that your disc will heal naturally, properly.
Next question coming from Bo, once more on Facebook, asking, when you said you only get 50% disc bulge, then will that be the 50% off my spinal cord?
Yes. So, Bo, great question. Let's pretend that you have a herniation pushing on your spinal cord. All right? Let's say this is the herniation right here. Okay? here's your spinal cord. So it's pushing on your spinal cord. It doesn't matter if I take the bottom half of this herniation, it's going to drop down away from your spinal cord. Or if I take the top half of the herniation, it's going to be away from your spinal cord. In the end, what's left is actually a good result.
Perfect. This next question coming from Sherry, once more on Facebook, asking, does spondylosis cause leg symptoms?
Yes, spondylosis can definitely cause leg symptoms. Spondylosis is a collapsing of the disc where the bones are sinking down on each other and the disc is getting dried out and degenerated, and we call that spondylosis, right? A dried out, degenerated, collapsed disc with irregular end plates. You can see modic changes. The point is, in the end, what causes your leg symptoms is two things: either inflammation from the back of the disc, which we fix with the Deuk laser disc repair, or a herniation or bone spur pinching your nerve, which we can fix with the Deuk laser disc repair. Either way, we fix the leg symptoms with this procedure as long as it's coming from the disc.
Lastly, we have a question from Smarzig on YouTube asking, have you heard of using red light therapy to heal faster after spinal surgery?
Have I heard of red light therapy to heal faster after spinal surgery? The answer is yes, I have, and I have patients who have done it, and they say that it helps heal. So I have no reason to say no, it doesn't help. I believe it does, but I don't know that it helps everybody after spine surgery. So apparently what it does, it affects blood circulation in the area and makes it heal better. I don't have any proof of that, and I wouldn't necessarily prescribe it myself, but I've heard from some of my patients that after surgery, after the laser surgery, that they heal faster and better.
And that's it. No current questions.
All right, we have one more surgery today, and this is a young man. He's an athlete, a professional runner. He's track and field. He runs the 100, the 200, and the 400, and he's very fit. He has a gigantic herniation at L5S1, pinching the nerve, and he has weakness in his leg, left side, and weakness with the foot, sciatica, back pain, and he found us, and he's from, I want to say the Carolinas, but I don't remember if it's, no, he's I think Carolinas or Georgia, I can't remember, but you remember?
Yeah, North Carolina, Raleigh.
North Carolina, Raleigh, North Carolina. He was born in South Carolina, but he's in school in North Carolina. Anyway, he's a track star, and he doesn't want open back surgery. He doesn't want a microdiscectomy. We all know those don't work, and if they do, the symptoms come back because they reherniate because the doctor never fixed the tear properly, never cleaned it up. So he's next, and I hope and pray that his surgery goes very well. His mom is here with him. He's young. I think he's like 18, maybe.
23.
Oh, he's 23. So he looks young. But that said, that's our last surgery. It's coming up next. This surgery went fantastic. I'm very excited for this patient. The last patient that I did the T11-T12 like this, he was a 15-year-old boy from Seattle, and he went to Seattle Hospital, Children's Hospital with his mom, and they just told him, get out of here. You don't need anything done for back pain. Turns out he had herniation with spinal cord compression. He was going paralyzed. He couldn't even walk. When he got to my clinic, he was in a wheelchair. Just kind of like this patient that we just did. And the mother sent me a video of him 6 months after the laser surgery, and he was playing basketball and running. So that was amazing. And again, we never get rid of 100% of the herniation. We just can't. It's not possible because of the limitations of the bone and the anatomy. But we get rid of enough that the patient's symptoms go away and they go back to normal. Now, he took 6 months to start running, and I don't know how long this patient we just finished will take before he goes back to being independent with walking. Hopefully it'll be quick. We got some pretty big herniations out, so we'll see. Everybody heals differently at a different pace. Have a nice day. Thanks for joining us. I'm Dr. Deuk with Henry here at Deuk Spine Institute, and we love teaching and sharing experiences for people to learn from.